So today I will continue the review of Dr. Gabor Mate's wonderful book. I really recommend reading this, When the Body Says No. I'm almost done with it. I have one more chapter left and I'm just amazed with it. It builds from chapter 1 through 14 and it's just amazing. So last week, if you got a chance to listen to it, I talked about the topic of a stressor. And I mentioned, I'm sharing what he says in his book, that stressor is a non-specific stimulus, varies from person to person. And today I'm gonna dive into stress response. And just as stressors are not universal, they vary from person to person, the stress response is also very non-specific, meaning that depending on what the stressor is stressing you, the stress response is not going to vary, it's going to be the same. So by definition, a stress is a physiological response to a perceived threat. So it doesn't have to be real. And it could be physical, it could be biological, it could be chemical, but most importantly, when it comes to trauma, it can be emotional. And even more importantly, you don't have to be aware of it. So it can be completely unconscious. So as it relates to trauma, and it doesn't have to be a present threat. It could be something in the past. And body cannot distinguish between any of these. Body cannot distinguish between emotional, real, perceived, past, present, conscious, unconscious. It does not distinguish between any of them. And that's the scary part of it. And what the stress response, these physiological responses does, it disturbs and destabilizes what is called homeostasis, which is the balance between the different systems in our body, and creates a disharmony and basically threatens the harmony and balance in our systems. It is a very narrow range of physiological conditions, and the goal of it is to keep the organism, us or animal or whatever, to survive and function for that period of time when the threat is present. So it is very important to understand there is a significant difference between acute stress response and chronic stress response. Acute stress response is a good response because it literally saves our lives. And it becomes destructive when it becomes chronic. That's the major difference that we're going to explore in this chapter. So it affects all of our body system. It affects central nervous system, including brain, nerves, pituitary gland. It affects adrenals, kidney, blood vessels, connective tissue, thyroid, liver, white blood cells, name it. But the most importantly, at the moment that we are threatened and we are in this mode of survival, the major organs that would be affected would be the heart, lungs, skeletal muscles, and emotion centers. So emotion centers are perceiving the threat. Obviously, the heart rate has to go up. The heart has to beat harder because really, body thinks that a bear is chasing you. Even though this is like an old emotion that we are unconsciously experiencing, the body thinks a predator is physically chasing you and you have to run. So we are going into fight or flight or freeze mode. So body is preparing you for fight or flight. So the heart is beating fast, pumping extra hard to give you a lot of blood circulation. lungs are expanding because you need a lot of oxygen. Skeletal muscles are all tense and ready to either run or fight, so they're all active. And emotionally, you are very aroused because you can be sleepy or whatever when you are getting ready to fight or flight. So a physician, or I think it was a physician, Hans Say, he looked at the bodies of chronically stressed people and noticed that they have enlargement of their adrenal glands, they have shrinkage of their lymphoid tissue, and they have ulcers in the guts. And it was linked to four systems. Obviously, our central nervous system, including brain, nerves, and centers that perceive emotions, our hormonal system, including the glands that are secreting different hormones, our immune system, and also our gut. But these are not, as perceived previously, not four separate systems. They are interconnected, and they are basically considered one super system. Candace Pert, a leading American researcher, states that the conceptual division between the sciences of immunology, endocrinology, which is hormonal systems, and psychology / neurosciences is a historical artifact. That's the way medicine used to think about it. These are not separate. So the way to look at this one super system, they call it psycho, neuro, immuno, endocrinology, a big full mouth word, but they simplify it as P&I system. So basically what is telling us that every one of these systems previously thought separate, they are extensively supplied by nerves. So every one of these systems, the immune system and the hormonal system, not only receive the chemicals produced by central nervous system, they literally produce the very same chemicals that our central nervous system is producing. They have their own brain. And these chemicals that are shared between these four systems, they're called information chemicals. Basically, this is a common language spoken between these four systems. They're one system, they're not four systems, they're one system, and they are readily talking to each other. So your thyroid gland, your adrenal gland, all of your hormonal glands are talking to your immune system, vice versa. They're talking to your gut, they're talking to your brain, and they're all active when it comes to stress response. There are a group of chemicals secreted by our immune cells. As you know, immune cells are mainly white blood cells. We have a variety of white blood cells. They produce this chemical called cytokines. And this chemical is responsible for making you sick. What do I mean by that? What I mean is that if your body is invaded by a virus or a bacteria, this chemical makes you feel tired, makes you feel sleepy, makes you develop fever, makes you lose your appetite. On the surface, it looks like a bad thing. Why is my immune system doing this to me? Well, your immune system needs energy to fight the virus and the bacteria. And if you're going on with your life as usual, you're spending your energy somewhere else. So your immune system is commanding your body to stay in bed because it wants to spare that energy you're spending on running errands or going to work, it needs that energy. So it literally keeps you in bed and uses that energy. Again, we are talking about the acute stress response for 2, 3, 5 days, whatever it takes to get rid of that virus or bacteria. And then your energy comes back, you feel better, and you go back to your normal routine. But if this became a chronic situation, you all have heard about chronic fatigue syndrome. So what is a chronic fatigue syndrome? That is your immune response that is triggered every single day. Your immune system is acting as if there's an invader, virus or bacteria, whatever, in your body every single day of your life. So it's literally putting you down, your energy, you have fatigue, you're sleepy, you don't have energy or motivation for anything, because it is under the perceived threat of an invader, and we get to that. So it is astonishing really to realize that our immune system and our hormonal system are really they have their own little brain, and they are in constant talking or communication with our brain and our emotional centers. Even endorphins, which are these chemicals, morphine-like chemicals that our body secretes to basically reduce the pain, and also it's mood altering, just like morphine it just makes you feel better. It even affects that when you have a chronic stress situation. So when you look at a nerve cell, which is a neuron, you see that they have millions of receptors on them that are responding to the messenger molecules, responding to hormones that are mainly made of the building blocks of proteins, which are called amino acids. And when amino acids form a longer chain or a bigger molecule, they're called peptides. And these peptides, even though there's receptors on the neurons, there's receptors on every other cell, immune cells, glands. So again, these peptides are not limited to any particular organ. They can be perceived and received by the receptors of all these other systems. The hub of the stress response system is called hypothalamic pituitary adrenal nexus, or HPA nexus. So hypothalamus is a part of brain that is perceiving and evaluating the emotions at the emotion centers, which is the limbic system in our brain. And once there is a perceived threat, hypothalamus starts releasing a hormone called corticotropin releasing hormone, or CRH. CRH then stimulates pituitary gland, and pituitary gland secretes yet another hormone called ACTH, or adrenocorticotropic hormone. ACTH then stimulates our adrenal glands. Adrenal glands have two main portions. The outer portion, or cortex, secretes a different kind of product, chemicals, than the inside of the adrenal gland, which is called medulla. Medulla is responsible for secreting adrenaline when ACTH stimulates. ACTH is secreted by pituitary gland. That stimulates the medulla of adrenal glands, and that produces adrenaline. And adrenaline then stimulates our our heart, cardiovascular, and nervous system, and basically gets us into fight and flight mode. The cortex of adrenals, they secrete steroids, they secrete cortisol. And for in the long or chronic stress response, cortisol or steroid is responsible for the inhibiting effect it has on immune system, meaning that it makes us immunosuppressed. When we are in chronic stress response mode, cortisol, which is secreted from the cortex of adrenal gland, suppresses our immune system. It also is responsible for ulcerations in our gut, whether it's stomach ulcer or duodenal ulcer. People who get Crohn's disease, which mainly involves small bowel, ulcerative colitis, which mainly involves large bowel. These are all really as a result of a chronic stress response. Also, it can cause osteoporosis and fractures by getting calcium out of our bones. So this is very important. I want to really stress this, even though I mentioned it in last session. The psychological factors that I named last time, meaning uncertainty, confusion, lack of control, lack of information. Sounds familiar? Sounds like COVID, right? In the past year, we have been confused. We have been uncertain about our future, about our present. We have been feeling out of control. And there have been a lot of misinformation, gossips, all kind of things. These psychological factors, they are the most stressful stimuli for our bodies. They are worse than a lion chasing us. And what is important when it comes to stress-inducing psychological factors, just as it is in trauma, as Dr. Gabor Mate says, trauma does not always require that somebody is physically and sexually abused. Trauma, all it requires is that you have some unsatisfied emotional needs. So if there is lack of love, if there is lack of information, if there's perceived lack of safety, if there's perceived lack of nurturing in your environment, especially as a kid, but even as an adult, lack of these emotional needs, these are the biggest stressors for our system. These are the ones that put us in a chronic state of stress and result in serious illnesses, including cancer and many other forms of disease. One of the most important components of our immune system are these cells called natural killer cells. They call it NK cells. These are literally the frontline troops. They're extremely potent. They literally go and swallow the virus, the bacteria, the chemicals, whatever it is that they consider invasion to our body, they consider foreign, including cancer cells, including any cell that has mutated and has not been able to repair the DNA damage, including the cells that they may potentially become cancer. These natural killer cells recognize them and they destroy them in an ideal situation. Now, 3 studies have been done on the caregivers of people with Alzheimer's. So this is not about Alzheimer patients themselves. This is about caregivers of Alzheimer patients, because we know that caregivers, and that can be caregiver of cancer patient, they are under a lot of stress. And if it's a long period of time, which even if it's a short period of time, it sounds like forever, because emotionally it's very, very draining. The very first place that they affect is your natural killer cells, NK cells. So they studied NK cells in the caregivers of patients with Alzheimer's, and it was striking. They looked at how their immune system was functioning, and they matched them age-wise and health-wise with a group of people who were not caregivers. They didn't have the stress of caregiving. And they compared their immune system of these two groups of people together. And they realized that the caregivers of Alzheimer's patients were extremely immunosuppressed. They looked at two other factors. They looked at social support. Did those caregivers have some kind of social support from other family members or friends or society, community? Those caregivers who did not have social support, their immune systems were even further suppressed compared to the caregivers who had a reasonable degree of social support. What was striking, that they followed these caregivers up to 3 years after the patients with Alzheimer had died. They were immune suppressed up to 3 years after the patients had died. What does it mean? It means perceived stress, right? The patient who was causing the stress is not there anymore. But the caregiver is still in the chronic state of stress because they're still carrying that stress with them up to 3 years. So immune system is acting as if the Alzheimer patient is still alive and these people are still caring for them. They looked at two other things striking again. They gave these people who were caregivers flu vaccine, and they gave it to age-matched, health-matched people. People who were caregivers for Alzheimer patients, only 20% of them developed immunity against flu. But the group that was matched by age and health status, 80% of them developed immunity. So why is that? Because the immune system is suppressed, because vaccine is very different from injecting somebody with immunoglobulin, which is basically already made antibodies against a certain virus or bacteria. When they inject you immunoglobulin or antibodies, they're basically providing your body with what it needs. Your immune system doesn't need to do anything. But vaccination is introducing some form of weakened or dead bacteria. They're just introducing the antigen to your immune system, and the anticipation or expectation is that your immune system is gonna get to work and produce antibodies on its own. So if your immune system is not functioning because of chronic stress, it's not going to create antibodies, and the person would not develop immunity even after getting vaccination. The third thing that they studied was wound healing. Our immune system is responsible for healing our wounds, because when skin is open, immune system perceives that as exposure to the outer world, world, because that's where the bacteria, virus, whatever, germs can enter our body. So our immune system perceives that, okay, our defense mechanism, which is the skin, has been broken. We better go repair it. We better go fix it. So immune system is responsible for healing our wounds. They noticed that in the caregivers for Alzheimer patients, wound healing took 9 days longer than the people matched by age and health. And we see that in people with diabetes all the time. They have non-healing wounds. In their situation, is more complex. In addition to having immunosuppression, they don't have enough circulation. Their nerves don't function well, so they don't feel pain. They walk on nails and stuff like that. So their situation is more complex. But purely from immune system standpoint of view, they're the same. Their immune system cannot heal the wounds. Another very important function of immune system is pain. You would think that pain is a bad thing, but why is that people with diabetes get amputation, get non-healing wounds? Because their nerves have been damaged as a result of diabetes, they don't feel pain. So they burn themselves, they touch something really hot, they don't feel the burning. They walk on a nail, they don't even feel it. The nail is in their foot for like 10 days, it gets infected, there's an abscess, and they just see, oh, there's an abscess on my foot. They never felt the nail. But a normal human with normal sensation, if they touch something hot or they walked on a nail, they would immediately notice it. They would immediately pay attention to the area that has been hurt, and that doesn't turn into an abscess or something. So pain is a defense mechanism. But this is the way Dr. Mate has described this as a secondary mode of perception for people who block their emotional pain is just genius. So when we have trauma, when we have painful emotions, such as too much sadness to bear, too much fear to bear, too much anger to feel, naturally what we do, we block them, we suppress them, we repress them, because we just can't get ourselves to feel them. When we block them, that doesn't mean that our body is not getting into a stress response. As you remember, at the beginning of the session, I said that it could be unconscious and it could be just a perception. It doesn't need to be a real present physical threat. Our bodies, when we are traumatized and we are not allowing ourselves to feel and experience the pain, emotional pain, I'm talking about sadness, fear, anger, grief, whatever it is that we don't want to feel. And we go out of our way by shopping, by being on the internet 24/7, social media, drinking, all other substances people get addicted to, food most commonly, dieting, exercising, working, name it. We do anything and everything possible just to avoid feeling or what we perceive as negative feelings. But guess what? Our bodies are still feeling them, and our bodies are still putting us in a chronic state of stress response. When it gets really bad and our body is really falling apart because the cortisol and adrenaline is all the time at highest level, we are getting ulcers in our gut, our immune system is suppressed, our bones are getting osteoporosis, and this is happening. This is happening all the time, 24/7. Then the defense system, our body's defense system, our immune system, triggers physical pain. Basically, by triggering physical pain, which is a secondary mode of perception, the body is putting us on notice. It says, okay, you don't want to feel the emotional pain that you have. Here are some physical signals for you that you cannot block, and you have to feel. You have to feel. You can't block your physical pain. Yeah, I mean, you can take painkiller, but you have to take painkiller. Otherwise, it's not as readily blockable or suppressible or repressible as emotional pain. So when we get into chronic pain situation or acute pain situation, that's a message from our body. The body is saying, you better feel your painful emotions. You better deal with your trauma, or this is your last warning. If you don't heal your trauma, if you keep avoiding it like you have been doing all your life, something really, really bad is coming. Worse than pain. That is our notice that if we don't change the way we have been dealing with our emotional pain and our sadness and our trauma, and we don't deal with it in a constructive manner, we don't feel it, we don't heal it, we don't treat it, then we are going to get serious illnesses such as cancer, such as MS, such as ALS, such as Crohn's, such as Alzheimer, such as ulcerative colitis, you name it, they're all caused by trauma. And what is fascinating that we will discuss in the upcoming sessions, not only Dr. Gabor Mate describes a type of personality, some traits that are common among people who develop cancer. He breaks it down into how these traits, then they are subcategorized and are different between different types of cancer. So the person who has lung cancer versus prostate cancer versus breast versus ovarian cancer, person who has Alzheimer, person who has ALS, MS, testicular cancer, each one of them have shared characteristics to the point that psychologists ahead of time with 97 to 98% accuracy could predict which of these people were going to develop cancer. I'm getting goosebumps all over my body as I'm saying this. It's just astonishing how ignorant our medicine is, our oncology is, our psychology is, because we don't practice trauma-informed medicine. Nobody even talks about trauma in medical school and residency. Is just unbelievable. So the unanswered questions that we will answer in the upcoming sessions are the following. Why are the cells of some individuals more susceptible to cancer or some kind of diseases than cells of other people? Why does DNA repair happen in some people but not in other people? Why do the immune system and other defense mechanisms keep cancer at bay in some people but not in other people? What accounts for vast differences in cure or disease progression from one person to the next, even when the identical cancer is diagnosed at exactly the same stage, and even when all other factors such as age, gender, income, general health are exactly matched. One of the most common questions I get from my patients, say somebody has been diagnosed with stage 3 breast cancer, and they ask me, what is my prognosis? I tell them, I cannot tell you what your prognosis is now. I can tell you what your prognosis is after you receive your surgery, treatment, and radiation, because I need to see how your cancer responds to treatments. And the reason I say that is that if I have just two identical twins and they have the same stage, the same type of cancer, and I gave them identical treatments, if one of them responds to the treatments and the other does not respond to treatment, they're not going to have the same prognosis. Obviously, the twin that responded to surgery, radiation, chemotherapy is going to have a much better prognosis than the one who didn't respond. So staging system in oncology is an attempt to predict prognosis and is purely based on statistics. So they lump a bunch of people with stage 1, stage 2, stage 3, stage 4 breast cancer, and they see statistically how well people with stage 1, 2, 3, and 4 did. And they assign a percentage of survival, local control, whatever endpoint there is to each stage. But are these people lumped together in stage 1 or 2 or 3 or 4 all the same? No, they're not. Well, the very fact they all got breast cancer, based on Dr. Mate, as we will review in upcoming weeks, they share some personality traits. They share some traumas. The very one thing that they all share is that they're all immunocompromised. Because if they were not immunocompromised, they would not cancer to begin with. And their immune system is compromised because they have been in a chronic stress response state. And based on that very factor, you can say that the person who got stage 1 has a relatively better immune system compared to the one who got stage 4. That you can say. But does any oncologist ask these patients, okay, tell me, about your past medical history, what diseases you have you been exposed to this, that, have you smoked, have you done that? Does any oncologist ask them, have you experienced any trauma in your childhood or adulthood? No, that is not even in our vocabulary. That is not even a question. That is not even a consideration. And that has to change. It has to change in psychology. It has to change in primary medicine. It has to change in oncology. It has to change everywhere, because trauma is the basis of all diseases. With that, I'm going to stop here and open to questions. And I'm going to stop the recording so you feel free to ask questions.